This is Dr. Michael Tapper from Lenox Hill Hospital and the Northwell Hofstra School of Medicine in New York, reporting to you today on behalf of an infectious disease advisor from the Infectious Disease Society of America annual meeting known as ID Week, which is currently ongoing in New Orleans. And I'm talking now with Dr. Sarah Wakeman, who is an addiction medicine specialist from Massachusetts General Hospital and Harvard Medical School. And Dr. Wakeman has been presenting here on a very important issue related to some of her work with HIV patients with substance abuse. So maybe you just tell us a little bit about your presentation.
Sure. So I'm going to talk about the HIV epidemic and the opioid epidemic, and actually lessons we can apply from the HIV epidemic to how we think about the current crisis with opioid addiction, and then transition into how we can successfully manage opioid addiction as a chronic disease, much like HIV is managed.
I'd like to hear some of your insights.
Sure. Well, I think where we are right now is in many ways where we sort of began in the early years of HIV, where we're really just documenting the death toll. We're seeing the headlines every day talking about otherwise young, healthy individuals dying from a treatable illness. I think the difference is that rather than needing to wait for science to catch up, we actually have treatments that work and that can save lives with opioid addiction. And the challenge is really implementing those and changing the way we think about it. And treatment outcomes with addiction are actually as good as they are for other chronic diseases.
It's interesting. It's a very interesting model.
Yeah.
And some of the community outreach programs are actually, the models are there already. We don't have to reinvent the models.
Exactly. We simply need to apply them to this new crisis.
Exactly. It's interesting because you're from New England, and I've been reading so much about the problems in Vermont, New Hampshire. Yeah. Someone told me that the single biggest growth industry is methadone clinics in Vermont.
Yeah.
And it's amazing how some of those areas of the country, but almost everywhere, have been impacted.
Yeah.
And of course, particularly for people who are injection drug users, it's a dual risk for HIV infection as well.
Absolutely, and other infectious risks. So endocarditis, Hep C, everything. I run an addiction consult team in the hospital, and so we see people every day with terrible infectious complications related to injection drug use. And
it's not limited to any particular class of individuals. I mean, in this very difficult year where people are being broken down by their classes, this is really an epidemic that cuts across all classes, all socioeconomic groups, all racial groups, all ethnic groups, all religious groups. And
all
I think
genders,
that's all genders, and that's really a major issue to keep bringing home from this meeting. And I'm very glad that they had your talk at this meeting, because this has not been an area that, apart from the infection, the issues related to infectious disease like hepatitis or some of the other injection drug risks like HIV, the ID community has really not been that actively involved in confronting this particular epidemic.
Yeah, and we know that patients with HIV who also have opioid addiction, they do much better when their addiction is treated. So they're more likely to take their medications, their HIV stays controlled. And if you ask patients, they want to receive their addiction care from their HIV doctor, not from a different doctor.
Right.
And so I think there's a tremendous opportunity for HIV doctors and ID specialists to become more familiar with how to treat opioid addiction.
And I think an important public health message as well, that we really have to get treat this more and more as a medical illness, destigmatize it to a certain extent, and really have a collaborative effort with public health as the best approach to another epidemic that's come along in recent years.
Absolutely, I couldn't agree more.
Thanks so much for your time.
Thank you. Thanks so much.